Thank you. So I always like to begin my talk with this slide. This little boy, Hayden, that I took care of over 2 decades ago, which is why it's pixelated and why I still have brown hair. And at the time that I took care of Hayden, shortly after, I was in the process of looking for a job. I'd already gone to college, medical school, graduate school. I did a clinical fellowship, a residency, a postdoc, and this was 18 years after high school, and I was now starting to look for my first job. And it was at Hayden's memorial service that I was sitting in the back of the room, and it was a time of deep reflection in my life, because here I'd done all this training, and I was interviewing for jobs, and I wasn't liking what I was seeing out there, and I was actually thinking about leaving science and medicine. And the reason for that was because as I was going around and speaking to faculty members, as I was looking for jobs, the questions I was getting were about how my career was going to help me shape getting the next paper, getting the next grant, how are you going to do for arguing for space and promotions. These were the 4 topics that were coming up over and over again. And of course, these had nothing to do with the reasons that I went into medicine or science. And so it was in the back row at his memorial service that I sat there and I decided I was not going to consider grants or publications or promotions or space, but instead I was going to design every experiment in my career toward making sure that other families didn't have to go through what Hayden's family went through, and little boys and little girls wouldn't have to go through what Hayden went through. And I figured if the other things come along, that's great. If they don't, I get to be a forest ranger, do something else that's really cool. That doesn't take 18 more years of training. So we've created a really, I think, unique intersection between science and medicine within my lab and clinical teams, in that the little kids that I take care of come over to the lab and they see the experiments we are doing. They get to look through the microscope and see their cancer cells. We get to tell them about the avatar mice that we make from their cancer cells that carry their cancer specifically so we can study it. And likewise, the scientists in my lab go over to clinic and get to see neurosurgery operations, get to visit with the families, understand what they've been through. We take a day every year where all the people in my lab take a day off of work and we cook dinner for the families of all the families I've taken care of for 20-some years. We get together and we have food and we have music and sometimes we even dance together. And one of the things I didn't really think about very clearly when I said I'm going to do whatever it takes is that a lot of this work is super expensive. And sometimes when we propose this work that is really cutting edge or where we really want to change things, the other scientists who are on the peer review panels think that we're nuts. And some of the work I'm going to show you today about tumor paint, the first 6 grants I submitted to the National Institutes of Health were all rejected for being highly speculative or overly ambitious. And so it was really these families that came through in the pinch and said, if you have a bright idea, we want you to move forward. If you have a brilliant person knocking on the door, we want to pay for it. And so these little kids and their parents over the last decade have raised over $8 million to fund the research that I'm going to tell you about. So I'm going to show you a little film clip here and ask you to recognize that this is a real team effort, not only among the scientists.
It just sort of gives you a little bit of a wake-up call right there, hey? Nobody wants to see that picture in the middle of your child's head. It doesn't take any medical degree to see that that is not right.
The key to brain surgery is to remove the bad stuff and leave the good stuff inside. Well, that seems pretty straightforward. However, it's not that easy. It might look great on an MRI. Inside the brain, it is very difficult to tell the difference between normal brain and cancer. Here, let's look at the first one, okay? It's all about millimeters. You're a millimeter off, take a few grams of tissue that belong safely in the brain, then the patients wake up not as perfect as they went into the surgery.
Hey, buddy.
Hi.
Hey. Keaton, like so many kids that we take care of, came in with a tumor, and we knew that we needed to remove that tumor and that we didn't want to take out normal brain tissue, which might damage him. We don't know whether his neurologic damage was caused by the tumor itself or by the fact that we had to perhaps take some of that normal brain to get the tumor out. We've got to find better ways to help prevent that in the future.
If we can see the cancer in the operating room, then we can kill the cancer.
I always wanted to find a way to bring light into the cancer so surgeons can see what we're doing while we're operating. Scorpions have been evolving over millions of years. They need to make a drug that can get into the brain and can paralyze their prey. The Israeli deathstalker scorpion makes these little tough mini proteins. And it turns out that this one happens to bind to cancer cells, but not to normal tissues. We still don't fully understand why. What we did was we attached a little molecular flashlight to that. And so when we put it into the bloodstream, the scorpion toxin finds the cancer cells and drags the flashlight into them and makes them glow brilliantly. The surgeons can see them while they're operating. You can immediately see even a few hundred cancer cells compared to the normal brain around it. In a matter of 10 years, surgeons will look back and say, I can't believe we used to remove tumor by using our eyes and our fingers and our thumbs. There we go. Good job.
I wish I had a time machine, so that I could travel to a not so distant future, so that they could have resected the tumor and not taken any healthy brain tissue with it.
So, although 2013 is quickly coming to a close, we're on target to begin our first clinical trial in Australia in the next month. What that film didn't tell you, because we really focused on the patients and my brain tumor kids, is that unexpected to us, we learned after developing tumor paint, this scorpion-derived peptide that has a little flashlight that lights up the cancer, that it also binds very specifically to breast cancer cells and colon cancer cells, prostate, skin cancer, and a whole number of others. I want to show you this one slide up here. On the top are two mice. The one on the left has no cancer. The mouse on the right has prostate cancer. And what we're looking at is the lymph nodes that the prostate gland drains to. Those that are labeled with an N are the lymph nodes that lit up and felt like lymph nodes. And as you see on the far right panel, those were packed with cancer cells. We'd expect that. The lymph nodes that felt like lymph nodes that didn't light up didn't have cancer cells in them. But there's the one little spot labeled with an L that felt to me just like a little wad of fat. And I was trying to understand, why is this lighting up? So I sent it down to pathology with a note that said, this feels like a wad of fat, not like a lymph node to me. And I got a note back that said, you were right, it was a wad of fat. But inside that wad of fat was a lymph channel traveling from one lymph node to the other. And inside the lymph channel were about 200 cancer cells. And this was able to light them up. So that day, we learned that this was somewhere in the range of 100,000 times more sensitive than the best MRIs, and the surgeons would be able to use it while they're actively operating on the patient. At this point, we transitioned this whole project over to a startup company that we spun out of the hutch called Blaze Bioscience, because my lab was really not well situated to do drug formulation and manufacturing and regulatory and all those other issues. And in the 2 years since we transferred it to Blaze, they found a different molecule to light up the cancers that attaches to the main carrier molecule. They did the formulation, the manufacturing, the regulatory work and such. And here I'm going to show you 3 pictures from a canine study that we did where families brought their dogs in that had cancer for surgery to be helped with tumor paint. Here you see a sarcoma surrounded by normal tissue, and you can see how clearly the tumor paint lights up the normal tissue. Now this is done with a research imaging tool that we use for mice and for other experiments. And we wanted to really work on developing what a surgeon would use in the operating room. So we collaborated with PerkinElmer, one of the major devices companies in this field, and they developed this technology for us. And you can see that this large green spot on the lower right is the area that the surgeon knew was cancer. But those other 4 spots that are lit up as green were spots that the surgeons would have sworn was normal tissue, that there was no cancer there. If they'd taken out the bottom right, they would have said, we got it all. But you can see that there's cancer that was not seen. And I think that this is happening in operating rooms all over the country, and this is the reason so many people have their cancer come back. This is another instrument that we developed with colleagues down in California at an academic institution. And in this case, what they did was took the endoscope or exoscope that neurosurgeons already use, and they just built a different back end to it so that surgeons could see the fluorescent molecule through the equipment that they're already used to using. And this is actually breast cancer, and you can see how beautifully it lights up and is distinguished from the rest of the tumors. And so I'm very enthused that in a few years that surgeons will have a hard time going back to doing surgery the way that they have in the past. And I'm really fingers crossed as we enter these clinical trials that they'll be as successful in humans as they have been in the canine patients so far. Now, at this point, I had transferred tumor paint over to Blaze, and it was an opportunity for me to rebuild my lab and to focus on what's next. And so I thought about what have we learned over the previous 7 years from working on this molecule that could help us as we consider other diseases. And one that I was particularly interested in attacking were these brain tumors that are not amenable to surgical resection. This is a brain tumor that affects the brain stem. And if a surgeon were to remove this tumor, he would separate the brain from the rest of the body. Obviously, nobody wants to do that. And all too often, these tumors are associated with gorgeous little kids who would otherwise have a beautiful life to live. And in the 23 years that I've been doing this work, I've never had a child with brainstem glioma survive. And so these kids and their families motivated us to begin thinking about other ways that we could approach this. And Patrick Pattison, who I think is a friend to your community, and I collaborated and identified 2 targets for glioblastoma multiforme, which is a type of cancer that kills most of the people that are affected by it. And I'm not going to go into all the science behind it, but I just want you to see on the right that what happens when we target these cancers genetically, the cancer cells blow up. That rather than making 2 baby cells like you see on the left, they go through what's called mitotic catastrophe and disintegrate. So we would love to be able to hit these targets, and you can't do it with traditional pharmaceutical drugs. These targets are located inside the nucleus, inside the brain, and it's a matter of 2 proteins that are talking to each other that shouldn't be talking to each other. And as I mentioned to some of the folks at lunch today, if you imagine that my left hand is covered with Velcro, and my right hand is covered with Velcro, and you were to develop a drug that's the size of traditional pharmaceutical company molecules, it would be like putting a grain of salt on my hand and trying to prevent these 2 from sticking to each other. On the other hand, if we're using a small protein, like the peptide that's made for the tumor paint, it's actually more like putting this projector button between my hands and preventing them. It's something larger that can prevent the protein-protein interactions. Now, everything I told you about came from the Israeli deathstalker scorpion. And as I mentioned in the film, this scorpion has had millions of years to get it right, to make a molecule that can cross the blood-brain barrier, that can get into cells. And as we began looking at it, we realized that there's more molecules out there like this that are made by other plants and animals. A few years ago, I was traveling in Provence with my family, and I went out for a bike ride one morning, and I was going past sunflower fields, and I looked at these sunflowers, and I realized every one of those sunflowers is packed with nutrition. And they're bright yellow, so they attract insects. Now, if I were an insect, why wouldn't I just go and eat them and strip all the leaves off of these plants? Well, the reason is that they make one of these small knotted proteins, and the small knotted protein inhibits trypsin, the enzyme that the bugs would spit on it in order to digest it so that they could eat it. And it turns out that lots of plants and animals have figured out the solutions to getting drugs across the gut wall that are resistant to stomach acid, that live long enough in the bloodstream to be a drug, that get into the brain. Plants and animals need these properties in the drugs that they make. In some cases, such as these, they're able to pass it down in their DNA to their offspring. And so we learned how to recognize these little drugs in the DNA code of nature, and all the DNA code is being put on the computers by other people in other labs. We have access to the genomes of all these plants and animals, and we've identified now every knotin, which is these little knotted peptides, from every plant and every animal in the world. And my lab is in the process of making every one of those. Now, that may sound like a big thing, but I want you to recognize how big it really is, because when we were at the peak of working on tumor paint, we could only make about 12 candidate molecules a year because we had to make each one by hand. The way that biologists or pharmaceutical companies make peptide or protein drugs is usually in bacteria or yeast, but bacteria or yeast choke on these little knotted proteins. They just can't make them. And so my lab developed a technology where we trick human kidney cells that we grow in big flasks into making these proteins and spitting them out into the media. And 2 guys, in the course of 11 months, went from being able to make 12 per year to being able to make 10,000 in 3 weeks. Before we started working on that project, one of the things I sat down and did, which we do before we start any project, is we looked to see why have other people failed in this arena. People recognize that these little knotted protein drugs could be good scaffolds for human drugs 23 years ago, but nobody's made any progress in evolving them into drugs. We came up with this list, and in those 11 months, the 2 guys on my team resolved 5 of the 6 problems, and we're actively working on the 6th one right now. So those 2 guys were the guys on the top, Chris Malin in the center, Colin Krente on the left. They've now been joined by other team members. Actually, since the slide was put together, there are even more. And now we're going after some new, interesting challenges that go way beyond even the kids with brain tumors that are not surgically resectable. We're looking in this case at a way that we could make little peptides, tether them with toxic drugs, and have them follow the exact same route that breast cancer cells follow as they go into the lymph nodes, so we could actually kill off the cancer cells that made it into the lymph nodes that might not be detectable by the surgeons, even with sentinel node mapping. We're considering another approach that's very similar to that for patients that have melanoma. Now, in some of the kids that I take care of with brain cancer, the surgeons can get 99.9% of the cancer cells, but unfortunately, there's a little layer that's left behind on the brainstem, and they can't get in there and start digging around without really damaging the kid. And we already know that we can light up those cells and make a film of them on the brainstem using tumor paint. And it turns out now that we're doing another collaboration with some of the engineers that we've met through the other projects, where we're actually going to create these little mirrors that can identify each cell that's lit up and direct a laser beam right at it and kill that cell without killing the cells around it. And so these are kind of pie-in-the-sky ideas that we have. And I would say that our team is kind of, like you heard yesterday, up in the air right now with no idea whether we're going to hit it or whether we're going to crash wildly on the way back down. So a few weeks ago, or a couple months ago, when Joe Palca did a story for NPR, that's one of the things he asked me is, how can you be careful about not overpromising that you're going to find a cure for a particular disease? We hear that all the time. And what I told him is that I'm not promising that we're going to find a cure for a particular disease. What I'm telling you is we're creating a platform that can be used by us or any of other thousands or millions of scientists around the world, and we can use this to address the potential diseases that they're working on. And these include things like autism, Alzheimer's disease, diseases that affect developing nations. We've developed tumor paint in less than 10 years, and we'll have the first in human data for less than $10 million. And that compares to regular pharmaceuticals, which cost $3.5 to $11.5 billion per FDA-approved drug, and typically take 15 to 20 years. So this is a whole platform. And we've really changed the way that we think about this to being a platform that I don't want to put it into a biotech company. I don't want to build that to a billion-dollar company. I don't want to sell that to a pharmaceutical company where it will end up in the hands of one team that is responsible to shareholders. I want to keep this library in academic space. And keeping it in academic space, I want to still leverage partnerships with these folks, but also keep it available to work on rare diseases, diseases that don't have a big market, diseases that have 60 kids a year that might be affected by them. Now, when I look at this picture, I see sparks of brilliance. This is like epitomized. There's a spark in the center of this violet. And this whole conference, I think, is captured in some ways in this flower and in this picture, because surrounded by the spark of brilliance is purple, passion, right? There's lots of sparks of brilliance out there in the world, but you need to have passion to drive it forward. And that beautiful purple color is on this fragile, thin petal that is also incredibly strong. And this also, I think, represents what we've heard here the last 2 days. All of this represents the kids that I take care of as well. And we had one little girl whose name was Violet, and she also had a brainstem glioma, and she also died of a brainstem glioma. And in the months before she died, she and her family recognized that we could never study and learn and change the course of disease for kids with her kind of cancer because we didn't do surgery on these kids. And so she donated her brain and asked us to take it out immediately after she died so that we could make mice with her kind of cancer and share them with other scientists around the world. And in her honor, in this world where stadiums are named after rich corporations, where buildings are named after wealthy donors. I wanted to name the most exciting science that I've ever participated in after her. So we established Project Violet, where individuals all over the country can now adopt one of these drug candidates for $100 and become a component of our research team and help us keep this in the academic space so we don't have to put it out into the hands of one group of people. Thank you very much.